good morning or good afternoon from wherever you're coming. We are delighted that you guys have decided to join us today. As we get started, I would like to invite you to sign up for the Intact newsletter if you haven't already. I'm going to drop that link in the chat. And I have a couple of slides to go over before we get into the main content. While we're doing that, if everyone would put their name and location so we can just get an idea of who's joining us today. Next slide. So this presentation was prepared under a cooperative agreement from SAMHSA. These views and opinions aren't expressed in this presentation are those of the presenters and do not represent the views of SAMHSA or the US government. I just have to say that. Next. And while we don't anticipate any issues, if security issues do occur, we're going to end this session immediately and will not resume using the same link. You'll receive a separate email with instructions on how to rejoin the session. And then we can go into our introductions. So unfortunately, one of our Intact presenters, Suki, was not able to join us today. But my name is Karina Joyner, and I am an intern with Intact. I'm in Nashville, Tennessee, and am a social worker. And I will pass it off to Jason.
Good morning. Good morning, everyone. I'm Jason Cram. I'm the Children and Family Section Manager at the Department of Health Services, State of Wisconsin. And my colleague today, Ann Kelly Keymichael, is having some technical issues, and hopefully she'll be joining us in a moment. Ready to move on, Karina?
Yeah, I guess so. Let's just go ahead and get going, and hopefully Ann will be here at any moment.
That's right. Okay. All right. Welcome, everyone. I'm Jason Cram, like I said, and some of you, or many of you, probably participated in the presentation that we did in this three-part series in January, where we covered at length the Children's Systems of Care self-assessment tool. But to kind of level set, we felt it was necessary to do a brief overview, less than 10-minute overview of the self-assessment tool, because the whole purpose of this presentation is we have a wonderful panel of folks that we will be introducing in a moment. And they actually are individuals who have completed the tool or have been part of the completion of the tool. And that's really the focus. But again, we want to make sure everyone understood what the tool was all about. So the purpose of our self-assessment tool, thank you, is to engage, equip, and empower counties and tribes in the evolution of their children's systems of care. Karina, could you put the link to the self-assessment into the chat? I'd appreciate it. And while people are taking a look at that, the self-assessment tool, just for reference, is we really tried to make it so it wasn't Wisconsin specific. And we encourage people to use this and use it and modify it and to whatever need they want to use it for. And as you'll hear, as we talk about it, it really isn't a tool that's necessary to any specific children's systems of care. It could be applied to any children's systems of care, across the United States and all the territories. Next slide, please. What the tool is not. It is not an audit, and we make that very clear when we work with tribes and counties. This is never intended to be an audit. It's definitely not a fidelity measure either. Although you can see elements of, say, a wraparound fidelity tool or wraparound fidelity scale within the tool itself, it was never intended to be a fidelity measure. It's not an intentional attempt to find weaknesses within a system. And it has also not been normed, validated, or standardized. So we want to be very clear about that. But we wanted to really focus on what the tool is all about. Next slide. The tool is a communication tool, and as you'll hear from our panelists, that's the strength of the tool. We like to use the word communimetrics tool. It's like we said before, it was never really designed to be a got you, more so to stimulate conversations within a system of care across systems partners. It's also an assessment of collective understanding, and by that we mean ideally, it's not just 1, 2, or even 5 people completing the tool. It's multiple people And ideally, it's not people from any one given system. So say it's not the behavioral health provider in that particular children's systems of care. Just completing the tool. The tool really should be completed by people with lived experience, service providers, family members. It could be including clergy. It could be including law enforcement. It could be including the judicial system, child welfare, all sorts of individuals who are involved with the children's systems of care, natural supports, employers. It's also a way to open up dialogue. And again, by our panel that we're going to have in a moment, you'll really see how that dialogue evolved. The tool is also ever evolving. In fact, we were very close to publishing the tool just before what we call the evolutions document, written in part by Gary Blau. And again, Karina, could you put the link to the evolutions document in the chat? If you have yet to read this evolutions document, it's a not a super long article, and we highly encourage you to read it. And the self-assessment tool, the current iteration, is based largely on that evolutions document. We were very close to publishing the self-assessment tool, and then the evolutions document was published, and we had to take a step back and realize we were missing some key elements. For example, we were missing an assessment on crisis within our self-assessment tool. So we went and revamped part of that tool. There were a few other elements as well. And so we consider the tool ever evolving, and we will update it as the literature and children's systems of care evolve. Next slide. Indicators of the self-assessment tool, indicators within the self-assessment tool. The self-assessment tool is broken down into 4 different parts. Guiding principles and philosophy, which they are basically straight out of the evolutions document. They are the guiding principles of a children's systems of care, which I'm sure most of you are familiar with. The other indicators include readiness, practice change, and human resources and funding. And we'll cover these briefly, and then we'll get into our panel. Next slide. The guiding principles, I think if you hit one more, actually, if you just click through there, you keep clicking through until you get all the 10 arrows. The guiding principles are, as you see here, these are, I'm sure, familiar with most individuals who are involved with children's systems of care, but strength-based, unconditional, all the way through collaboration, natural supports. Some of these are more, there's the 3 primary ones of cultural and linguistic responsiveness and community-based and family voice and choice. In Wisconsin, we also like to add the unconditional care as one of the other 4 pillars of a strong children's systems of care. But again, these are, as if you click onto the link that Karina put into the chat for the actual self-assessment tool, you will see that each of these 10 elements or 10 guiding principles are individually analyzed within that system. Next slide. The next area or focus area is readiness, and you'll see here, these are the 5 areas within that self-assessment that are individually scored. Next slide. Practice change. These are the individual indicators that are indicators that are individually scored within the self-assessment tool. No one of these jumps out as one that's any more important than the next, but each of these needs to be individually reviewed or analyzed within that system. Next slide. And the final area is human resources and funding. Again, all necessary elements or indicators of a strong system of care. We're going to then introduce our panel. You can go to the next slide, but then I just want to show the pictures, and then you can stop sharing now too, please. Let's introduce our panel. Our panel includes Shauna O'Keefe, Rachel Kildee, Jessica Berkman, and Heidi Rotger. Let's start with Shauna. If you want to introduce yourself, please.
Hi, my name is Shauna O'Keefe. I am a children and family supervisor and a coordinated services team initiative, which is a fancy word for wraparound here in Wisconsin, director for a rural county here in Wisconsin.
Thanks, Shauna. Rachel?
Hi, my name is Rachel Kildee. I am part of a program in Wisconsin that works with 9 different counties, and I am the multi-county clinician for that program.
Thanks, Rachel. Jessica?
Good morning. My name is Jessica Barrickman. I am the Operations Administrator for the Recovery and Wellness Consortium. Rachel and I are colleagues within that 9-county partnership and serving both youth and adults across the lifespan within this mental health and substance use program.
And Jessica, please also add your other hat too for Wisconsin, which is a pretty important role you have in the state of Wisconsin, if you don't mind.
I'm also the chair for the Wisconsin Council of Mental Health.
Thank you, Jessica. And Heidi.
Hi, I'm Heidi Rutger. I'm a Wisconsin certified peer and parent peer specialist and a Plex person with lived experience advocate.
Thank you all. So we have for our panel, we have, let's see, looks like about 18 questions. We may or may not get through all of them. We'll make sure we stay on time. The questions are broken down for the participants, just so everyone's aware. The panelists already have the questions in advance, but we'll help facilitate. The questions are broken down into 3 different phases of the self-assessment tool: the preparation phase, the facilitation phase, and then the evaluation and follow-up phase. We have some questions that are, I was just reading the chat. We have some questions that are specific to Heidi and more general questions too there for everyone. And so I know you guys probably had the questions in advance. You probably didn't have an opportunity to figure out who's going to answer them, but it's open to any one of you 4, if you will. Let's start with the first question in the preparation phase. And we consider preparation phase anywhere from 9 to 6 months in advance of actually completing the tool. That's what our guidance is. That's what our best practice is. That's what we found that counties have been using or doing the most. So they've been really thinking about it well in advance of actually sitting down and completing the tool. But for all 4 of you, what were the initial motivations and thoughts and plans to take this process on? Anybody jump in, please.
I can get us kicked off here. So within our 9-county mental health consortium, when we looked at kind of the motivating factors of why we even started down this journey, it really was around trying to improve sustainable recovery for children and adults with mental health and substance use challenges. In doing that, the program that we provide, mental health, substance use across the lifespan, the core, it's called Comprehensive Community Services. The core of it really is outlined in the 10 guiding principles of wraparound. So when we thought about why we were doing this, it was to take the program that we're already providing and how do we take it to the next level and really identify where are gaps and where are strong suits and how do we improve sustainable recovery.
How about others? What were the initial motivations and thoughts and plans that you guys considered when you took on this process?
To be very transparent, Clark County's initial motivation was that our state partners invited and encouraged us to participate in this children's system of care self-assessment tool. But with that, they also offered support in reviewing the assessment with state partners at the table to provide guidance on not just the tool, but suggestions on next steps. So while our initial motivation was the state encouraged us to do so, once we initiated that process, we found so much value in as Jessica said, understanding how the system of care raters also connect with our wraparound values, the values of CCS, and really in a larger aspect, the values that all of our systems of care for children, youth justice, the child welfare system have for the families that we're working with, and saw it as an opportunity to continue to provide continuity of care and just do better for our kids.
So I know I think all of you guys, when you took on this project, you really embraced the idea that it wasn't just a given system who's completing the tool. It wasn't just the one agency or the county human services or whatever it might have been. So what were your recruitment efforts? What did your recruitment efforts look like when you were recruiting, say, family and youth voice into the process?
One of the things that we did for our recruitment is that we were working with 9 different counties. And so then we really talked to each county to kind of make this assessment their own. We really wanted them to feel that it was reflecting what was going on in their specific county rather than coming together as 9 and just doing one huge assessment. And so we identified some champions within each of the counties that were passionate about seeing this assessment move forward. And we gave them some guidance and some ideas for different people that we think we would really like to see at the table. And those people included people with lived experience, people that provided services to our clients and consumers. We wanted people from the county present as well. And also we encourage community members such as teachers, clergy, other people, natural supports. We're really looking to get that information in there as well. And also some of our counties brought in people that were currently receiving services so that they had a voice in the process. So we really encouraged them to reach out and look for these individuals, and then each county took on that task and found the people within their communities to be part of this assessment.
Thank you. How about others? Again, recruitment efforts for family and youth voice.
I can say just a little bit more about the lived experience within our 9-county partnership. A really valuable asset that we have in Western Wisconsin is called our Plex Committee. It's people with lived experience. It's a committee that serves our 9-county region. They provide recommendation, they provide their own advocacy grassroots initiatives. Oftentimes counties will seek out their feedback on any changes that might be impacting individuals that we're serving. So we have a ready, accessible group of individuals with their own lived experience that we're able to reimburse them for their participation, that many of them rose to the table, Heidi being one of them, that sat in and dedicated a lot of time to these assessments. So as Rachel was saying, we had some individuals that were currently receiving services through CCS. And then we also had a handful of folks that were at the table, a part of our lived experience committee, that had their own experience in some way with mental health or substance use.
Nice, nice. A question specific for Heidi. Heidi, so when you were first approached, and could you actually tell us how you were approached to be a participant in the process, but when you were first approached, so what inspired you to be involved then in the assessment, and any barriers or advantages that you considered when you agreed to that, to be involved?
So first, Jessica approached me as a member of the Plex committee, as she mentioned. So that's how I learned about the opportunity. And I would say there are 3 main things that inspired me to participate. The first is my hope that I can use what I've been through to create positive changes that help others. And opportunities like this, advocacy, peer support, they're all a huge part of my own healing journey, and they help me in return. Another is the wraparound training I've attended a number of times. Because I've been a part of teams, I can see how the guiding principles and the practices make a big difference in the outcomes of people receiving services. And finally, my desire to feel part of a greater community working together towards solutions and improvements inspired me. As far as barriers go, I would say virtual participation was what worked best for me, and it wasn't an option in all the counties. I also had concern that I might not be able to feel comfortable to share as openly if there were people that my family members or I had previous involvement with at the assessments.
Thanks, Heidi. I was gonna ask a follow-up question. Did you participate in the process for all of the counties, Heidi, or just a few or one?
I participated in the county that I live in's assessment, and then I was also able to participate in another county.
Nice. And what motivated you to do both counties, or what considerations did you take on when you thought about the beyond just your home county?
Well, I really like to be a part of as much as I can be. And, so there were advocates from and from our Plex committee who maybe lived in the other counties, and I wanted them to have the first opportunity and, be available if there was need in other counties to have the voice of lived experience at the table.
Nice. Question for everybody. So, okay, you tell your systems partners, okay, we're considering taking on this project. The state's, Sean is saying the state's really encouraging us, and we've been champions of this project for a long time. But then you say, look, this could take months to complete, and multiple meetings, in-person meetings. How did you guys create the hype? How did you get people excited about this, or even willing to participate when they realize that this isn't just a one and done, a couple hour meeting? This takes some time. How did you get the hype and people excited about this?
Well, I can jump in for us. We actually had a hype meeting that we planned ahead of time, that we talked about, like, what are ways that we can get people excited about wraparound and about just the philosophy of wraparound and utilizing wraparound. And I'm going to be honest, we did our hype meeting before we understood how long it was going to take to do the assessment. So we considered having pom-poms and streamers, and we just wanted to do anything visual. We didn't do those things, but we were considering anything visual to really get people excited. And I think at one point we had a video that Jessica utilized in the discussions that she had, but really we just tried to be very mindful and planful about ways that we could get people excited and catch the vision behind why we were moving towards wraparound, because we just really believe if people understand the reason behind it, that they will also want to be part of that process.
I'm going to deviate from my script here. What was probably the most unusual in terms of not a typical systems partner person that you had involved in your process?
Can you say more about that?
Well, I'm thinking,
I think we had board members.
Yeah, county board members. That would be one that's not a typical systems partner in the traditional sense. So you guys had county board members participate.
Yeah,
How did you have to educate them to start with, like, on what this is all about?
I think there was a level of that. And I also think that happened at the local level. So that champion that we talked about in each county, their responsibility was to really talk within their team of who does it make sense to have at the table. I had done some intentional outreach to some other collective partners that we didn't necessarily interface with a whole lot, but we thought, hey, they're still a part of our community. Those were a bit more challenging because they really didn't understand the system that we worked in, and inevitably decided not to be a part of the assessment process. So I think the folks that came in had a good general idea from the local leadership sharing what it was about. The other thing that I'll say, our 9 county variations, is it really was up to the county, individual county, to decide how broad the scope of this was going to be. So for some counties, they decided we're just going to focus on our comprehensive community service program. So this one specific program and integrating a wraparound approach into this. Other counties, if their culture and their county dynamic and their administration was more on board and they felt like they were ready to move forward, Some of them incorporated this into their human service as whole. And one that I participated in, it was human service and their public health department
Wow.
embarked on this journey together. So how broad the like scope of services was really county driven. The other thing just to say about the hype was we wanted to make sure people had a general idea of what this was. And people have heard of wraparound, the 10 core components. It's not rocket science, right? Like you see it and you're like, this makes sense, right? So yes, we want to make sure people were informed, and just as important, if not more, we wanted folks to know that this wasn't about what you've been doing wrong and we have a solution to do it right. That's not what it was about, because the core of our programming has these components, right? It was more, how do we take what we're doing and take it to the next level and really focus on community? Because we didn't want people leaving the hype meeting feeling like, aren't I doing this already? Like, are you saying I'm not doing it well enough? Or are you saying I'm not doing this? So that was really, I think, intent in the like creating buy-in, if you will. And we had been talking about it within our leadership team for a really long time, because we had slotted this to start pre-COVID. And then the pandemic hit. So like everything got pushed on the back burner to like figure out pandemic. So the like language had been within our like leadership team for years, several years. So
Nice.
For our community, we started on a much smaller scale. It was also just prior to COVID, and then follow-up and planning meetings had to be adjusted. But we've started on a very small scale with our internal voluntary children's programs, our community partners, our champions. So we have some school districts, law enforcement, and of course our families with lived experience. But then through this progression, we were able to kind of develop a culture of just constant self-assessment and feedback, because system evaluation and self-assessment can be viewed as really scary or threatening to employees, as Jessica mentioned. So being able to provide an overview of what the assessment is and what it's not, and starting to use the language in preparation was really important to ensure that when we're around the table and completing the self-assessment, that we're allowing ourselves to be vulnerable and really providing honest reflection of both of our weaknesses and opportunities for growth, as well as things that we're doing really well and taking the time to celebrate those.
Heidi, did you have to do anything specific to try to get some hype behind the project with people with lived experience?
I think, we talk about it in our Plex meeting, and I was a part of the initial hype day, which was very helpful as well to, get more information and create that sense of teamwork and our mission. So I wouldn't say I had to do anything in particular with individuals of lived experience, because it was a whole group effort from the top down,
Thanks. I see Karina put that stuff in the chat. I'm glad you did that, Karina. I have like one or two more questions about preparation, and then we want to do a Menti poll too. Did you already launch the Menti poll, Karina, or is that kind of the link to the future?
It's there if people feel like answering it. They can go ahead as we continue to hear from our panelists.
Great.
Just wanted to go ahead and put that in. So
yeah, thank you.
Let's gather some answers.
Absolutely. So you can, as you're listening to us talk, please click on the links to that Menti poll, and we can start getting some group feedback from the 100 participants who are on the call right now. Jessica, you kind of alluded to this, but because the tool was written originally for children's systems of care, some of your counties looked at it from across the lifespan, though, from birth to the elderly population. So did you have to do any adaptations to the tool, which we are completely comfortable with? We encourage people to actually adapt the tool. That's why we really kind of whitewashed it of anything specific to Wisconsin, in fact, and we want this to be used across the country, and we want it to be adapted and modified to meet whatever individual needs that you have. But did you guys have to do any adaptations to the tool to meet your perhaps unique needs in your counties or your consortium?
Yeah, absolutely. So all 9 of our counties did lifespan, maybe not to birth, because the program that we focus on is a psychosocial rehabilitative program. So, but we do serve small children in that. And so we went through it before we even started the assessment process. We didn't change really any of the language or content, because it's all applicable to whether you're 10 years old or you're 90. Community supports, natural supports, unconditional, like those are things as humans that we need to have sustainable recovery. The only language we changed was where it said children's or children's system of care. We made it more of an inclusive language of youth and adults or individuals or families versus using just the word child.
And I want to say to all the audience, we had never envisioned when we wrote it that it would be applicable across the lifespan. So it was so encouraging for us to hear that you guys had adapted it to meet the your unique needs. And it really, we love that, because obviously we all I'm sure realize that 18 is not a magical age. It really does apply to across the lifespan, and the wraparound principles are not youth specific either. They're very much applicable to everybody. How about other folks? Rachel or Shauna or Heidi, any thoughts about adapting the tool to meet your needs?
I don't think that we had any original adaptation. As we're kind of progressing, and I'm sure the conversation will flow into this, we are looking at adapting it as we're using it in like the Children's Court Improvement Project or in other facets outside of our voluntary children's programs.
Wow, that's awesome. That's fantastic too. I don't want to get too far off topic, but I didn't realize that you guys had also, one of you mentioned that your public health department participated, and I would love to hear more about that offline, to hear if your public health department is embracing wraparound principles in their approach. That would be pretty amazing. So similar to the teaming process, Shawnee, it's a good segue. Similar to the teaming process, we know that you all considered the roles and responsibilities of people as you're completing the tool. There's some clear need for specific roles. So can you tell us what those roles are? For example, the champion role, the facilitator role, the note taker role, timekeeper. Maybe I already gave some of those away, but how you arrived at those, and any challenges or successes with making sure you had all those roles covered, and maybe additional roles that we didn't even add in that list.
Well, we used people that were very passionate about the wraparound process to be our champions. And so with our 9 counties, we asked each county to identify an individual that would step forward and be that champion to really help with this assessment process, to pull the team together for each unique county. Because Jessica and I are part of what is referred to as the lead. And so as such, we don't work for a specific county. So we don't know all of the ins and outs of each unique county as far as who their resources are and who their natural supports are and all of those individuals. And so we really wanted to make sure that nobody was left behind. And so we encourage each county to identify their own champions so that that person could lead up pulling this team together. For us, we facilitated the discussion. And so there are 3 of us, Jessica, myself, and then another colleague, Denise. And the 3 of us kind of took on 3 counties apiece, and we facilitated it. And the purpose behind that is so that the counties could truly just be part of that discussion and process and not worry about taking notes and not worry about what's the next question, but they could just be present in the moment with each section as we went through. Because we had actually, one of our counties had done this assessment prior to us doing it as a 9-county consortium, and they had done it with their children's. And so then they gave us a lot of feedback. And from that feedback, which we'll probably discuss it a little bit more too, with some other questions, but along with that feedback, we found that that the facilitator felt like they couldn't fully engage in the process because they were so concerned about facilitating. And so that facilitator and the note taker ended up being one of the three of us, Jessica, Denise, or myself. And so then we would help each other with note taking, and then we would also do timing. And the timing was so important to keep people on track, because it would be very easy when you get so many minds into a room, brilliant minds into a room with so many wonderful ideas. It can be very easy to just keep going and brainstorming and coming up with solutions rather than identifying the core of the issues. And so then part of the way that we kind of kept ourselves on track is to do that timing, because Jason, you had kind of talked about how these assessments take time, and we want to honor that time. And part of the way that we honored it was by keeping people on task. And it was easier to probably hear it from us that we got to stay on task than it would be to hear it from each other. And so we took on those roles for our consortium.
Very good. I just put a few things in the chat, and I just basically repeated what Karina already added, and that's to make sure you have a link to the self-assessment tool. I think it's important to note too, before we go to the Menti poll, just is we keep talking about counties, and I am very well aware that Wisconsin is somewhat unique in the country. Not, and many states are. Almost all the human services behavioral health programs are administered by the state, whereas in Wisconsin and some other states, it is county operated and state supervised. And so we really, each individual county, of which there's 72, and then there's 11 federally recognized tribes in Wisconsin, we really approach those as individual systems of care. So we have 72 counties, 11 tribes, and we as a state, at the outset of the presentation, I said what our purpose of the assessment tool is, and our purpose of how we view our role too at the state level is to engage, equip, and empower counties and tribes in their evolution of their children's systems of care. And so you can kind of hear from, Heidi, Rachel, Shauna, and Jessica is that, they're taking ownership for their own, the system of cares that they have purview over. And we view our role in the state much as that of best practice and guidance too. So Karina, you want to say anything about the Menti poll, or are we going to show any results, or how do you want to approach that?
So I've shared the link where people can view results on their own. We're not going to share it on this, but we, at the conclusion of all 3 of these sessions, everyone who has registered for one of these events will get a handout that sort of summarizes what we've covered in each of the 3 sessions. And so we're hoping that with this participation in the Menti, we'll be able to share out a visual of all of that information that's been gathered. So the current question that's live is, who are you bringing to the table? So ideally, sometime in April or May, we'll have a sheet that has a nice word cloud of who all of you 103 participants would invite to your table. So that should be really exciting. And then there'll be 2 following questions as we go in through the next 2 phases with our panelists.
Thank you for the clarification. So the question that's on there right now is more or less, if you had the ability to invite anyone to the self-assessment process, who would it be? My colleague Ann Kelly Keymichael and I often say this is the Craig Culver question. So if you're from Wisconsin or from the area, Culver's is a very, very prominent place, semi-fast food place, and Culver's is also very philanthropic, and it just seems like one of those, the corner ice cream shop guy or woman, they could be part of that process too. And that's what we really try to encourage people to think about, is it's not just the standard systems partners, it's really anybody who touches the life of that child. It could be clergy, it could be Boys and Girls Club, it could be any of those folks could be Craig Culver's himself, you know, or your local Culver's or whatever the case might be, your local McDonald's. But those are all key players in the children's systems of care. We're going to move to the facilitation phase. We have a handful of questions here too, as well as a Menti poll for this process as well. But the facilitation phase, I'm going to start with Heidi. Heidi, could you describe your experience in participating in the process? You know, what was the most helpful or engaged you the most in the whole process?
My overall experience with the process was really positive because I got to come together with a diverse group of community members, use my experience, and look all together at what's going well and what can be improved. Both counties provided safe space for open conversation. Both counties that I participated in provided safe space, open conversation, free of judgment, opportunity for everyone to share their thoughts. I felt like I was able to offer value to both assessments I participated in, but I can say it was definitely easier to rate my own county because of my direct experience within it. What was most helpful and engaging for me, receiving the materials ahead of time on the topics like the principles of wraparound, the core competencies and skills, along with the assessment tool to review. Also, when it felt like counties were prioritizing the assessments, they were organized and considerate of everyone's schedules. I appreciated it. It was helpful to have that timer that Rachel talked about to keep us on track, and also getting a recap of the strengths and opportunities before we shared our ratings.
Oh, good, yeah.
When given the opportunity to rate the counties anonymously, it helped me provide more honest feedback because I didn't feel pressure to align my thoughts with others. Getting financially compensated for attending the assessment meetings helped me feel like my time and lived experience was being valued. And finally, what engaged me the most was the genuine open dialogue, free of any power dynamics, just a comfortable place.
So amazing. That is so amazing. Especially the last part you said, I think is the most powerful, is free of any power dynamics. And that really is, I think, the vision of what we really want to make sure is how the tool is being incorporated. It really needs to be a communications tool, and that communications tool, like you said, needs to be free of judgment. For Shauna and Rachel and Jessica, when you were kind of structuring this process, what were some of the logistics that you had to consider? That could be timing of day or financial compensation, all that kind of stuff. So what were some of the logistics that you had to consider to make sure that you could get maximum participation in each of the meetings?
Well, one thing that we considered, our county is quite rural and quite vast. Transportation is a pretty common barrier. So having opportunities for individuals to either participate remotely via phone, or another thing that we did was have facilitators reach out and discuss this tool with families that maybe wouldn't feel comfortable attending or wouldn't be able to attend, so that we were hearing their voice and choice while we were completing this assessment as well.
Rachel, Jessica?
Yeah, well, one of the things I saw a comment in the chat about the amount of time, and it's an investment. And we made sure that we were transparent about that in the beginning. We had received feedback from one of our county partners that had been through this assessment process years earlier as an individual county. So we, Rachel had shared earlier, we took from their experience, and based on their experience, we're under the understanding it would take probably between 6 to 8 hours to be able to complete the assessment. Now that varied from counties that said, hey, we're just going to focus on this one program, versus much broader, because the conversation got a lot broader. But we were cognizant of that. in being transparent, so people knew what they were signing up for, right? And the timekeeping was important. So they saw the timekeeping, not necessarily this like punitive thing to like keep organized, but they wanted to participants wanted their time used best as well. So when we started a meeting, we said, you know, most of our meetings were about 3 hours. Not all, but that seemed to be the trend that counties decided on. Feedback we had heard was doing 1 hour, like you just get started and you felt like the time was up. A full day was a lot for someone to commit to, and brain power, like a whole 8-hour day is a lot. So many of our counties did several like 2 to 3 hour sessions. Some, not all, some counties opted to provide lunch or snacks. I think that helped just to like, it helps with engagement, right? I mean, food just makes people kind of relax a little bit. And we really, when we set the table and the hype, we really presented and we went in with intentionality that the results that are going to come out of this, we have 110% intention of creating positive change with it. I think far too often, like you take an assessment or you participate in something and then you're like, nothing happened. Like what changed? What, why did we do this? So we've been really transparent too of like saying this is what we're doing with the follow-up. And so folks really felt like, I hope felt like, and from what Heidi said, felt like that their time was well spent and would change our system for the positive. So the person that said, yeah, it's a little shocking the time, I feel that. We dedicate a lot of time, the counties dedicate a lot of time. And it was fun. Like, I think once we got into it, it was energizing, especially coming off a pandemic. Like we were talking about real stuff that was going to positively impact the people that we're serving, which that's why we're all here. And I think during the pandemic, we kind of lost some of that. It was like, how do we like maintain status quo, right? So I think people generally enjoyed it.
So powerful, Jessica. I also want to address the comment in the chat too about just the overwhelming nature of the time commitment. You can make this however long you want it to be. We're hearing from a group of counties in Wisconsin that probably took it to the maximum level of investment, right? We've had counties who have done this in one sitting in 6 hours and they were done and they produced their plan. And that's what they wanted to do and that's what worked for them too. So I really encourage people, yeah, you know, what you're hearing today really could be, this is a significant investment, there's no doubt. But if you're thinking on taking this on, you know, you can really make it however you want to make it. You can complete it however you want to complete it. I would encourage though, that you actually do this in person to the extent possible and not just do an online survey tool, because the value is in the communication. And I think Heidi said it best when, you know, that no judgment zone, that she felt free and able to offer her suggestions. It's you just don't get that necessarily in an online survey tool. It really is a communimetrics tool and it's that communication that really can be the catalyst for change within a system. I'm going to skip the next question, you guys, and go on because we're running up against time a little bit. But a big question I have for everyone is consensus. If you're participating in, if you're a participant in this and not a panelist, and you've clicked on the link to the tool, you'll see that there's a rating scale of 1 to 4. Some counties get creative and they do start doing decimals. Fine, you know, you can do decimals, that's no problem. But we really encourage people to look at this as a 1, 2, 3, or 4, you know, response or something like that. And that's hard because that's really a forced choice. You have to arrive at a choice. And if you're a system with maybe there's, I'm just guessing, Shauna, how many people did you have at your maximum number sitting at a table or on a Zoom call? Would you have 10, 15 people at a maximum meeting?
Yeah, probably I would say 15.
So consensus, wow. How did you arrive at consensus? And I want to hear from all of you. And I think for our participants listening in, that's a pretty vital process? Because yeah, you could all come in with your own rating, but you have to arrive at a consensus at some point. How did you do that?
Robust conversation, right? I think that you keep calling this a community metrics tools, and that's really what it is. It is a means to elicit conversation in a non-confrontational and way where you can be really vulnerable. And so for us, our consensus really led to what was the lowest rating, right? Because unless we're all very sure that we're rating ourselves at a 3 or a 4, there's still room for improvement, and there are still opportunities that need to be addressed. So in general, we have, robust conversation. We did include decimals, only 0.5s, not 0.25 or 0.37. But it generally came down to what was the lower of the ratings, and then just accepting that as the perception of those team members that were at the table or our community partners, and recognizing that there's always areas for improvement.
I think the voting process and just what you were just saying, Shauna, like I know in our 9 counties, we did it differently and depending on who was facilitating. And I think that was okay because it really was about consistency, right? So if one particular county voted a certain way, their numbers would be consistent because they've been doing the process together collectively the whole time, versus another county maybe did it a bit different. The groups that I facilitated, we had pieces of paper, or if there were folks virtual, we had one person that they could email their numbers to that was like a facilitator role, so everyone didn't see their number. We did decimals. Sometimes it was just fun, like we needed to find a little bit humor, so someone did 3.72 just to make it a little bit fun. But so my group, it was much more anonymous, and then we added them all up, divided by how many are in the room, and that was our average, and that was the number that we put on. Rachel, I think you and Denise maybe did a little bit different, which was okay. Yeah, go ahead.
Yeah, we allowed the counties to decide how they wanted to proceed because it was their assessment. And for the most part, the counties just wanted to throw numbers out there. And it was interesting because I like both for different reasons. I like the anonymity of being able to just vote and put it in a box. And then there were also times that when people would throw out numbers that it would get challenged, and more discussion came out of those challenges, and not in an inappropriate way, but in a very safe way of, well, and this was discussed, so really, should that be as high as it is? And it went from like some high numbers to bringing those numbers down, which was interesting. And other times it was bringing those numbers back up too. Like I see the progress in this area. And so it was interesting that the way that everything was being captured.
Love it. Love it. As you were going through that consensus process, or the whole facilitation process, were there any aha moments for you guys? Like, and it could be on the entire system scale, or it could be really an individual indicator level aha moment. But were there any aha moments like, wow, we just didn't know this, or we're doing better than we thought we were, maybe?
I can think of just a couple aha moments. One of the things that I think my takeaway was the need to go with the flow. This is a process, and we didn't have the entire thing mapped out to like a tangible degree every step, right? Because we were embarking on it for the first time, right? And that kind of whole plan, do, study mentality of, okay, this is working, or maybe we need to make a tweak for our next meeting that we come together. So I think being fluid with it, and recognizing that each team that's doing the assessment is going to have a different dynamic, and honoring that dynamic and that flow like Rachel was saying, some of, whether it was scoring or it was how we were facilitating to make sure that everyone was being heard. I think really an aha moment that I feel like we did pretty well was really setting the table for a safe space. So when we first started the conversations, I know the ones I was facilitating, I gave examples of, Heidi might say this, and I might have a different perspective because my experience was different. And that different perspective is where our conversation's gonna like explode and be amazing. And so really giving space to, I think it can get easy to be groupthink, right? If there's more passive personalities in the room or more dynamic personalities that can kind of overpower. The other thing that we had, and maybe Heidi, if you could speak to this, was the ability with our people with lived experience meeting outside of the assessments to kind of talk about, debrief, and pump each other up a little bit. If you would be open to sharing kind of your experience in those after meetings, which were already scheduled monthly meetings that we have, but.
Yeah, that's one of the things I love about having that group to go to, is whether we're advocating and doing things like this. If we feel things or have frustrations, we can take it back to that group and, just talk about it and work through it and process it together and feel supported and like we're not alone or, misunderstood or any of this. So I think that was a huge benefit to those of us with lived experience to have that to go back to.
Very good. Thank you. We're going to move on to the next phase, which is the evaluation follow-up. I do want to point out our wonderful technical host, Karina, has been adding to the chat the Menti poll for the next question at the end of the facilitation, which is, what is the purpose of building consensus among those who are completing the tool? So if you would, I'd really appreciate if you would click onto that poll and add to that conversation. We're going to go to the evaluation follow-up phase, and we're also going to leave a little time for Q&A at the end. So I'm probably skip a few of these questions too to my panelists. I do want to, though, before I forget, I do want to point out, or I do want to call out, we will I can put this in the chat as well, my email address, but if you are outside of Wisconsin and you're considering taking this on, we want to hear from you. We want to hear, the good and the bad. And if you're going to take this on as a project, if you're going to use our tool, and we just want to hear how things are going too. Oh, thank you, Anne. So please, if you are considering taking this on or using the tool or adapting the tool, we want to hear from you, because like we said before, the tool itself is an evolution, and we're really, we want to make it better each time. So next questions. Let's see. This is the crux. You've gone through this entire process. You've spent months doing this, or maybe weeks, or maybe hours, depending upon who you are. And you've reached consensus. You've completed the tool. You have a numerical score for every single one of the indicators. How did you make sense of this all? How did you make sense of all of the strengths and the barriers and the opportunities? And what did you do? Like, what was your next steps then after you've completed the tool? What did you do with all that information? That's always the hard part, is you've collected all the information. Now what do you do with it? So what were some of the things you guys did?
One of the things that we did is we took the numbering system and we pulled out averages to look at the numbers that were coming up for each county. And then we were able to rate what were the high numbers and what were some of the lower numbers. Then what we also did is we kind of got together, and Jessica, myself, another colleague, and then actually Anne and Michelle from the state. So we pulled 2 state workers in with us, and we did a sticky note party where we gathered the information from every single county. We put them in areas on a wall with sticky notes. We used Post-its and stuck them up on the wall. And then we went through and we found the themes of all of these sticky notes that we found on the wall. We were very
Wow.
visual people that day. So we had a sticky note party, and it was a lot of fun, and it was a little chaotic. But from that, we found a lot of our themes, and then we documented all of those themes, and we tracked all those themes, and then we took that information and presented it to our various counties and our work groups and individuals like that, so that we could talk about our next steps.
Let's go to the next steps then right away. So our best practice guidance from the state is to then take all this information and convert it in, just like you do working with the child and family team. You know, and I think Rachel, you said you celebrated those strengths, and you're going to take advantage of those opportunities too. I think they're both vital. You have to celebrate the strengths. How did you, not knowing, I don't know how many opportunity areas you had, and we're not going to call them deficits, but I don't know how many opportunities areas you had. But how did you, as a system, decide if you had 10 opportunities, you can't possibly take on 10 change projects within, you know, a short period of time or the next 2 years, however you want to approach it? How did you prioritize those? And then what did your action plans look like? So maybe you identified, I'll just make it up, maybe you identified 3 or 4 or 5 of those opportunities. How did you then convert that into an action plan that everyone could embrace? Question for everybody, please.
Well, I can get us started. Shauna and her team are a bit further along than we are in the process. So we're in the midst of it. But so our initial, like, pulling this together, Rachel kind of talked about like filtering through, then we filtered, we met with our teams. Honestly, we started with low hanging fruit. And we looked at what are some things that we can do today or this month that would take a step forward. One of the things that we talked about through the entire process, beforehand, during, is this is a marathon. It's a slow process of getting to each day. Hopefully we're a bit more integrated with the wraparound approach, right? Because the idea of this light switch and all these changes were going to happen, that gets in people's heads, right? And you just don't have capacity to like do that. So initially we started with what are some easy things that we could like keep the energy flowing and start right away. One of them was a newsletter, because we information came out that folks within our system don't know what's going on, or even that they have the opportunity to be a part of a Persons with Lived Experience committee, or so one of those little things was a newsletter. So we picked a few things that we could start right away, and then 2023. So we did our assessments in 22. 23, so starting now, what we're calling is laying the foundation. So in April, we're having training for providers, counties, and folks with lived experience that want to participate. And we're really going to walk through the 10 guiding principles, and with the assessment results on hand. Counties are going to come as a collective group so that they can sit with their folks that they work with the most, and are going to come up with action steps for 2023 that don't take tangible resources, aka staff, like significant staff time. So they're going to pick these things that they can go back, and it's an approach, right? How you engage. 24 is our training year. So 24 is what we're kind of picturing as like the launch. The reason why we're having a year of foundation is because some of these changes we need to do are system issues, and our capacity issues. So we can't ask folks to do more with less. It doesn't work that way. So our system is looking at what are some of these things that we're looking at that may require additional resources, staff, training, and that way we have a year to manage any types of budgets that may have impact and make decisions. One of the things within wraparound as it relates to our programming is we anticipate they're most likely for most individuals, not all, will have a lower caseload to be able to and have this level of engagement. You can't make that just happen, right?
Right,
Folks are
right.
at capacity. So that's kind of the tangible next steps for us. One, laying foundation, really making sure that our folks are part of the decision making. It's not us at the lead county that are saying, hey, these were the top results. This is what you're going to do. We're showing these are the system results. Look at it, and now you decide how this is going to look moving forward.
This isn't a question as much as it is an observation too. Of course, there's political ramifications too, because we're talking about positions and county boards and so on too. So I imagine there's a considerable amount of convincing and proofing that that you've undertaken this process, and here are the findings. Heidi, when you during the final phase of this process, the follow-up process, or the kind of the plan setting process, can you identify anything that you wanted to make sure was captured in those plans, that you want to make sure that Plex voice was captured in those plans?
From my experience, and in listening to others with lived experience, I really wanted to make sure that the need for more use of lived experience and voice, along with the youth perspective, was captured. That greater advocacy needs to be happening both locally and statewide so that we can make some of these changes. That there should be increased use of natural supports, and we need to offer help for people with creating and identifying those relationships. We have to take a holistic look at the connection between physical health and mental health and substance abuse, and see how we can work with that.
Yeah.
And the importance of the continued training for everyone: supervisors, facilitators, providers, people receiving services, and the larger community, on a variety of critical topics. And I really feel the plan captured these things and more. And I just want to add that I really appreciate that the RWC has invested in doing this assessment and included lived experience, and is dedicated to the work that is required to take what was learned and continue to improve, both as individual counties and as a collective group. And I'm really grateful that I have been able to be a part of it.
Thank you, Heidi. For the participants who are listening in too, if you're at a state level or a larger systems level, I want to remind everybody that the vision or the purpose from our state's perspective is to engage, equip, and empower counties and tribes in their evolution. I said that before. One of the values of having multiple systems complete the tool, then too, from a state perspective, at least in Wisconsin, is we get all these results, we get all these numbers, and we can then start looking at these numbers in aggregate too. And so I'll just not even making this up. We've clearly identified that almost every single system that's completed the tool has scored themselves fairly low in natural supports. And so that tells us at a statewide level, because we're responsible for a lot of trainings at a statewide level, that we need to be doing a better job at a statewide level, and maybe even advocating for at a national level, perhaps it's NTEC level too, that natural supports is an area that people are consistently ranking themselves low in. So we as a state need to be doing a better job of providing training and support and technical assistance in that area. So it's not just this system that's focusing on that, it's really a statewide system. I'm going to ask probably one or two more questions, and then I know Karina put in the Menti poll again for this final one, which is, now that you've developed a plan, what do you do with it? Please complete that. But for the panelists, Lessons learned, road bumps, pivots, anything that you guys, looking back, you would, if you had that crystal ball that you could have predicted the future and avoided those road bumps that you may have encountered, or lessons learned, all of you, I want to hear from all of you, like, if you will, what were some of those lessons that you've learned throughout the process that you would love to impart to anybody considering taking this on?
I have a comment that goes with that and backs up just a bit, Jason, of your talking about the state's involvement. And this, I think, was something that we learned through the process too, and how we created hype, how we got buy-in, was that our state partners have been at the table through all of it. I'm looking at Ann right now. When we first started scheduling these, we have 9 counties. And each county met probably on average 3 times. That's 27 meetings. And our state partners were at almost every single one of those. If not all of it, part of it, or being a face, not to regulate it, not to like be a moderator, but to be there and say, we're looking for trends, and some of the challenges you're facing are system issues, and how can we help? So I think that's huge in like creating your buy-in, and there's follow through on that. Like, it wasn't just lip service and saying that either. So appreciate that on our state partners. The other piece that I know we've talked about is creating that safe space. And if there's a moment where safe space breaks down, because we're talking about emotional, personal things, right? Want the work we do, we're vested in it and don't want to hear that something maybe isn't going well. We may have had, whether you're identified as a lived experience member or you're a county person with your own lived experience, or a provider with your own lived experience, there's feelings involved in this. Like, you can't take that out, right? And so our lesson learned is create as much safe space as you can, set the table. And when you realize that someone had a moment of not feeling heard or not feeling safe in sharing, to address it. So in a helpful way, there's 1 or 2 times that we asked for a follow-up. Can we talk after? And how are you feeling? I saw, you reacted this way, or it seemed like, you were having some feelings around this, and giving space to that, because we're human, right? And yeah, that would be maybe my takeaway.
Beautiful. Thank you, Jessica. How about others? Kind of your final takeaways, or if you could provide some guidance to anybody considering taking this on.
I also would just like to add that for Jessica's and my experience, and Heidi's too, that we are looking at revising like how wraparound is being utilized as well. And so when you consider how to implement it yourself, it may not be as complex as what some of it is for us, because we are going to use it across the lifespan and also across other programs within our counties are identifying wanting to use it as well. And so I just want to put some encouragement out there also, and maybe Shauna can speak a little bit more about this, because we have this aspect of taking on this really large project. And yes, the assessments do take time and make time for that, but that safe space that Jess was talking about really allows people to like, it allows you to have a good understanding of what's going on in your county so that you can make those tangible changes. And if we don't have that area where we can just talk openly about that, then no changes get made. And so the purpose behind it is really to make those changes. And so tough conversations are going to happen.
I'll piggyback off of that. Because, I think it's really important that we address the barriers that came up in the assessment, and we have the opportunity to collaborate together on how we're going to overcome them. So it doesn't prevent us from making change. And I would say a couple other things that, I would like to share is that it's important that this isn't a one-time deal and that there's follow-up on how things are going and the progress that's being made. And last, having the opportunity for participants to give feedback on how each assessment went overall is important for identifying barriers and successes within that process too.
I'm just going to piggyback on something Heidi said. This hasn't been around for Wisconsin all that long. It's been around for probably 5 or 6 years, and we're still trying to get a lot of people to participate in it. We don't have it at this point. We don't have guidance on best practice for how often you complete it, but probably every 2-3 years or something like to that effect. Maybe a little longer, 3 to 4 years. But the beauty in that is that you can go back and look at your previous results and actually see where you've moved that needle to, and realizing it's still a rather an objective or subjective, a subjective approach, because it really is the community-metrics part to it. But we do encourage that kind of test, retest approach, but giving yourself a good window of time because it is a project to take on. Shauna, do you have anything you want to add to that final lessons learned crystal ball kind of thing?
I would really just echo everything that Jessica and Rachel and Heidi shared. If you are considering undertaking this, just recognize that this is a large evolving system change, and being open to kind of following that subjective data where it takes you. And so for us, that meant knowing that we had our county board and other, fiscal agents to answer to when we're looking at system changes, using that information gathered to influence how we collect raw data that can be presented, and then using that data to more, better inform our goals, and just being open to it being an evolving process. We went from utilizing this as an internal self-assessment for our voluntary children's programs, these mental health programs, and we're expanding it into the work that we do in our youth justice sector and our child welfare sector. And we're now looking at utilizing the self-assessment with our children's court improvement project to make sure that all of our community is really on the same page. Here in Wisconsin, we've been very fortunate that the wraparound values have been really echoing what our Families First initiative says. And that means that children belong with their families in their community. And so having that support from both of our Department of Children and Families and the Department of Health Services has been so integral in kind of making these larger system changes.
What a way to wrap it up. That was perfect, Shauna. Thank you for all of that. We have a few minutes for Q&A, and I know that there's some and also Karina put in, again, I want to just remind everybody, Karina put in the chat, the Menti poll, and I think you have access to all 3 of the Menti poll questions now. So please, if you haven't done so already, take the time to do that. And we have some time for Q&A, and I know there's a few slides at the end too. We have to do some formal wrap up to make sure we have all of our needs met here. So is that right, Karina?
Yes. If you would like, I can go ahead and read some of those Q&As that I pulled from the chat.
Sure, that'd be fantastic. Sure.
Yeah, so first from Alicia Overstreet asked, does that approximately 8-hour time include accommodations for individuals with disabilities who may need additional time expressing their thoughts, which I feel like you all touched on. It of course can vary. Do any of y'all have any experience with that exactly?
I just think the timing is fluid. It depends on your group. It depends on how you have it structured, and thinking about what are those types of accommodations that you might need. So I don't, the 6 to 8 is like, it's an estimate.
I'll just add that as a person who sometimes takes a while to form my thoughts, things will come to me down the road. I feel just offering the opportunity that if something comes up after, once they're at home or something, and they think of something that they didn't get to talk about, that they could send an email or share their thoughts, and that it might be able to be considered as well.
Thank you.
Yeah, thank you. One more I pulled from the chat from Philip Hudson asks, how do you know when is the right or good time to conduct the assessment tool? And are there things that need to be considered before conducting? I feel like that was a good question. How do you know when the right time is?
Wow, that I'm going to actually ask Anne. Anne is the colleague. She was having technical difficulties. And if you could just say a few words, and because you're the one that's in connection with every single system in Wisconsin that's completing the tool, how do they know? How do they know when's the right time to start to take on this project?
Yeah, that's a good question. I think anytime is the right time from my perspective, but I think when I sit at the table with counties and tribes, and they're talking about difficulty in working with or that partnership with other systems, that's when they discover, like, we're doing a lot of conversation about placement or community-based, and we don't have any representatives from child welfare at the table, or we're really trying to work really hard on our diversion programs, and we don't have youth justice at the table and restorative justice. And so I think they discover it when they're talking about strategies, and then they think, oh gosh, we don't have the right people at the table. And so we need to figure out, how do we get everybody to the table? And the self-assessment is a really great way to do that, is to try to figure out, okay, so how do we work collaboratively? I think Jessica is so funny because I went around to regional directors meetings and I shared about the tool for the first, when we first were working on it and piloting it. And Jessica's like, I think you said you heard me talk about it like 7 times before you said, wait a minute, I think I've heard this before. This might work. I know that when people are talking about strategic planning, this is a great opportunity. And so they use it as like, okay, how do we collect everybody's thoughts? And this is a great way, Shauna, as you said, of having that data to really support kind of that planning. So when people ask, well, why is this a good thing? Well, we have some data to support it. This is why, so I hope that answers the question. But yeah, I think there's no time like the present time or the right time. But I think when counties and tribes are looking at strategic planning, and when they're looking at, those difficulties in collaboration, or they're seeing gaps in that collaboration, that's a great opportunity. It's a good time.
Thank you, Anne. Oh,
sorry.
go ahead, Heidi.
I might also add that, I got to participate in a couple different counties, and, we decided as a consortium to do this thing as a whole, and there was a window that the counties were supposed to get things done in. And I believe that one of the counties maybe was struggling a little bit with a lot of turnover. And so then that makes it more difficult for them to be able to prioritize and have that organization and do the outreach required. So maybe if that's something that a county is experiencing at the moment, it's not the best time to take that on if there's choice.
Great final words. I'm going to hand it over to Joanne and Karina because there's a few slides left that we want to make sure everyone's aware of. But from Wisconsin, we want to say thank you all for participating and listening. And again, if you are going to complete the tool and you're from a different state, please let us know. We want to hear how it's going.
Yeah, thank you, Jason. Thank you again to our panelists, Jessica, Shauna, Heidi, and Rachel, and to Anne and Jason for bringing us all around this tool once again. On that note, we have our 3rd and final session coming up March 21st, so a month from today. I'm going to drop those links in the chat. So if you're not already registered, go ahead and register for that third and final session. I've also dropped a link to our System of Care Summit that's happening in May. It's going to be 3 days of lots of information from experts in the mental health field and system of care around the nation. And then when you close this, we're going to, it's going to populate a survey. And if you wouldn't mind taking just a couple moments to fill that out, that is super important to us, and helps us continue to provide cost-free technical assistance, and it lets us know what you need more of. Thank you guys so much. You'll receive the recording and the PDF copy in an email following. Have a great day.